Welcome back to Africa 54. Oscar-winning actor and comedian Robin Williams, who was found dead last week, had been suffering from severe depression. Williams was also suffering from the early stages of Parkinson's disease at the time of his apparent suicide. Williams' death has sparked a conversation about mental health and the need for more awareness and treatment to help those who suffer from the conditions. Observers say mental health services and experts are scarce in sub-Saharan Africa. Joining us live via Skype from Accra, Ghana, for more on the subject is Humphrey Kofie, Executive Secretary of the Mental Health Society of Ghana. Mr. Kofie, welcome to the show.
Thank you so much.
Thank you for joining us via phone, actually. First of all, tell us about how depression is affecting the population in Ghana where you work.
Thank you so much for having me. Actually, depression is one of the most commonest mental disorders in Ghana. Indeed, it is the second most commonest that is able to manifest through people becoming sad, depressed in certain moods, loss of interest, pleasure, and other pleasures. I mean, basically, putting them into a situation where they feel tired. It's something that at the moment is becoming so severe, leading to suicide in the case of Ghana. In fact, to the extent that the rate of suicide among Ghanaians is increasing at an incredible and alarming rate.
So indeed, what are the causes about this increase? What are the causes for this increase?
Well, some of the causes of depression are basically sexual abuse, stigmatization, emotional conditions, loss of relations. Of course, poverty is also one that triggers some of these conditions, and among others.
So then what is being done to help those who are suffering from depression and other mental illnesses? Because it has been reported that in Africa, mental health is really not at the forefront of health services.
Yes, well, we have the psychiatric hospitals and the psychiatric units in the region, in the district hospitals and also in the regional hospitals, but that is not enough to serve the population. Indeed, when you are talking about the human resource, the number of medical psychiatrist consultants to the population is so low, to the extent that we have currently about 12 consultant psychiatrists to a population of about 24 million. So that tells you how there is a mismatch of service in terms of the human resource to those who really need such treatment.
Okay, and Mr. Kofie, very quickly, what are some of the services that you offer through your organization? What do you do?
Well, we provide some psychotherapy. We basically provide some counseling services to those that need it. Indeed, the United Nations Victims of Torture Project has supported us for this year to be able to meet some of these conditions of depression, especially among women between the ages of 15 and 60. Because in the cases of the women who are aged around 60, the society has become such that they see them as possessing witchcraft.
Mr. Kofie, thank you so much for joining us today. And that was Humphrey Kofie, Executive Secretary of the Mental Health Society of Ghana. He spoke with us via phone from Accra.